All right, 21 minutes after 8 o'clock. Thank you for tuning in. The subject you need to know about but don't like talking about is colorectal cancer. You don't like to talk about any cancer, right? But colorectal is kind of one of those things like, or maybe it's a guy thing, right? We don't like to talk about it. Dr. Rajesh N. Keswani is on the phone. He's a colorectal cancer expert and the Associate Professor of Medicine of Gastroenterology and Hepatology at the Medical Director of Quality for the Northwestern Medicine Digestive Health Center. March happens to be Colorectal Cancer Awareness Month, which I didn't know. And colorectal cancer is the topic, the importance of screening, the trends, the signs, the symptoms, the diagnosis, and the treatments. And I think the screening is probably the most important focal point. Dr. Rajesh N. Keswani, good morning, sir. Thank you for being on the show.
Thanks for having me, and I really appreciate you giving us the opportunity to talk about this important issue.
You're welcome. Where are you right now? Where are you calling from?
I'm in Chicago at Northwestern Medicine, and I'm excited to be talking to you right before March, the Colorectal Cancer Awareness Month.
So has the test changed at all in the years that you've been doing this?
So things have changed quite a bit in the last decade, in fact. In one case, with colonoscopy, which I think many of you are aware of, which is the test that we use to identify polyps and prevent colon cancer, we've really made a large focus on trying to ensure that the highest quality colonoscopy is delivered to our patients. And during that same time, we've had some competing technologies, including the stool test that you may have heard of, which are also there to detect colon cancer and try to prevent colon cancer death. And so it's really changing yearly.
All right, is the colonoscopy, does it, I don't any other way to ask this, but does the scope or the camera not go deep enough, and that's why the stool test is necessary?
No, the actual colonoscopy is an excellent test, and it gets through the colon and finds the vast majority of polyps and prevents the vast majority of colon cancers. The issue we have is really getting to make sure that all patients get screened. And despite that, the fact that colonoscopy is not very difficult, we still can't get every patient screened. And so it's important to give patients options. And for our patients who don't wish to undergo a colonoscopy, we do offer stool-based testing. The primary difference is that stool testing is better at detecting colon cancer, whereas colonoscopy is better at preventing colon cancer. And so I think it's important to have that discussion.
And what are some of the symptoms? Because sometimes things can look like something else when they're really not.
So in general, I'm glad you asked that question. In general, we don't want to wait for symptoms, but it's important to be aware of symptoms that may occur. And the most common symptom you hear about is blood in the stool. And this is important for us to think about as we find that some younger people are getting colon cancer before the ages where we recommend screening. So if you're having frequent blood in the stool or change in your stool habits, even if you've been screened for colon cancer before or you're below the age where we generally recommend screening, it's very important to talk to your primary care provider or see a gastroenterologist to see if you might need a colonoscopy.
I don't know that this would be across the board kind of a question, but in other words, Florida might have different rules than the other states, but are the screenings covered by insurance?
That's a great question. Screening is in general covered by insurance. The only time that screening is generally not covered by insurance is if you're having a colonoscopy for symptoms, in which case there is often a copay. And also if you get a stool-based test and it's positive, and then you get a colonoscopy, that's often not covered by insurance as well. But screening colonoscopy in general is covered by insurance, but obviously you need to talk to your insurance provider before the colonoscopy.
Are there any ratings out there on physicians as to who would be the best to do this?
That's a great question. The transparency around physician quality isn't where we always want it to be. What I advise patients, and that's one of my passions, what I advise patients is that simply ask your doctor some of the important questions that we know exist for colon cancer screening in terms of colonoscopy, which is how often do you find precancerous polyps in the colon? They should be finding polyps 25% of the time at least during their colonoscopies. And how often do you get a complete colon examination when I get a colonoscopy with you. A physician who is committed to high quality colonoscopy will know how well they're performing and can share those metrics with you as a patient. And I think that's a very important thing to either ask your primary provider or your gastroenterologist.
Can a woman who is pregnant have this test in case she sees blood in the stool or anything?
Yeah, that's a good question. Most of the time, blood in the stool during pregnancy is unrelated to any colon issue. It's more related to hemorrhoids. But we do have women who need colonoscopy during pregnancy for other reasons, such as colitis, and there are ways to safely do that. We try to avoid doing anything in pregnancy if we can avoid it, but almost anything can be safely done.
If a polyp is found, how long does it take before you can determine if it's cancerous or not?
So we remove polyps during a colonoscopy. In general, most polyps would take years to turn into cancer, but some high-risk polyps can turn into cancer within a year or two. We send them off for analysis to find out if they're precancerous or not. We usually know that back within a couple of days, and that will impact when I, as a gastroenterologist, will tell you to come back for your next colonoscopy.
Ah, okay. Is there anything that we do lifestyle-wise that causes the polyps to form? Maybe this would be the non-cancerous ones.
Mm-hmm.
Yeah, that's a great question. The real issue we think is that we're changing how we live our lives in general. We're a little bit more reliant on processed foods and red meats, which tend to increase our risk of colon cancer. We don't exercise as much as we like to, and we're a little more sedentary than we used to be. And we had a higher history of smoking. Luckily, that's going down, but that's also a risk. And so what I like to tell patients is all the things that if you saw your regular doctor, they tell you to do to prevent heart disease and other cancers also prevents colon cancer. So it's really just important to live a sort of a high quality, healthy life, and that will help us reduce the risk of colon cancer.
Really good information, Doctor. Can I allow a phone call to come through? I see the phone ringing.
Of course.
Okay. Dr. Rajesh Keswani is our guest. Good morning. Thank you for calling. You're on there with the doctor.
Yes, thank you, doctor. When you reach your 80s, should you still be getting screened?
That's a wonderful question. At some point, we like to tell people that the risks of a colonoscopy, although very small, outweigh the benefits. And if you're in your 80s and you've had prior normal colonoscopies, we don't think that there's any value in continuing to put you through the colonoscopy procedure. So it's important to also stop screening for colon cancer at a certain age. And in general, 80s, we would not recommend colonoscopy as long as you've had one before.
All right, very good. Thank you for the call. Do we have to have a day of fasting prior to the test?
Yeah, we've actually made some strides in that as well. And we've been able to adjust the diet before a colonoscopy where you don't actually have to fast. You can just eat foods that are low residue the day before the colonoscopy and so still be able to eat some of the foods you like the day before the colonoscopy, but you still need to do the bowel preparation the night before.
Okay. Doctor, do you want to leave us with a website so people can learn more, please?
Thanks. We're happy to have you come visit us at dhc.nm.org, where you can learn more about colon cancer screening.
Okay. Doctor, thank you for being on the air. Thank you for what you're doing. You're obviously making the world a better place.
I appreciate the opportunity. Thank you.
You're welcome. We'll be right back.